Hello, I'm Cami Buck.
And I'm Sandra Nino. Our Capstone project is over the biological effects of radiation. We will discuss the X-ray interactions with matter, the different types of biological effects, the ways the radiation is measured, and the improvements in safety.
Starting off with the history of X-rays, William Rankin discovered X-rays on November 8th, 1895. By 1896, there were already reports of damage to people's bodies from the radiation. A big contributor in the movement of using X-rays is Thomas Edison and his assistant Clarence Daly. Unfortunately, Daly suffered so much radiation damage that he died in 1904. He was the first death from excessive exposure to X-rays in America. After several people started having visible biological damage, such as burns on their skin, known as skin erythema, there started to be concerns on how safe X-rays were.
So before going straight into the effects, our poster reviews what ionizing radiation is, along with talking about two important interactions related to our topic.
Photoelectric absorption is what forms the diagnostic images. The photons from the X-ray beam enter through the patient's body. These photons interact with the atoms and are absorbed by the inner electron of the atoms. After the electrons absorb the photon, they are ejected out of the atom, creating an empty space in the electron shell. An electron from the nearest outer shell moves to fill the void, creating a cascade effect. Photoelectrons increase patient dose because the photon is absorbed inside the patient's body and causes ionization from the electron being knocked out of the shell's orbit.
So the second important interaction is Compton scatter. And so our poster has a short explanation to understand what Compton scatter is and how it is related to dose and biologic effects. To briefly summarize, it's a partial absorption reaction that involves interacting with an outer shell electron in the atom. And so moving forward, we wanted to touch on such radiation effects, deterministic and stochastic, by defining and differentiating the two. Both have different dose response curves as well, which we actually added a chart below that explains this along with how those curves are portrayed. In summary, deterministic is nonlinear threshold, meaning threshold level must be exceeded to see effects, and stochastic is linear non-threshold, meaning the probability for effects to occur increases as dose increases.
Moving on to measurements, there are 4 different ways to measure radiation. There is air kerma that measures the radiation that is in the air during the exposure, absorbed dose that measures the amount of radiation absorbed in a body, effective dose is how to measure the dose to the whole body, and equivalent dose is measuring the dose to a specific organ or tissue. To conclude our Capstone project, we wanted to mention the ways X-ray technologists practice safely to try to reduce patient dose. The 3 cardinal rules to reduce patient dose are time, distance, and shielding. They also practice tight collimation to only radiate the body part that is the focus of the image. Technologists also practice ALARA, which means as low as reasonably achievable to keep patient dose as small as possible while capturing diagnostic images.
And lastly, at the bottom of our poster, we have our references. And this concludes our presentation over biological effects of radiation exposure. This topic is overall very important in the medical imaging field because we should always follow the assumption that no minimal safe dose exists. And so radiation safety should always remain a priority when imaging patients. Although the beginning of X-ray was dangerous to practice due to not knowing the results of excessive radiation exposure, we find it to be quite enlightening to see how much safety has progressed.
Thank
Thank
you
you
for
for
watching.
watching.